I think that the information that we have currently about this is early. I think that the studies are very small with these patients. And so I think that it may be a little bit premature to say that we can completely reverse Alzheimer's or prevent progression of it with these therapies. We don't currently have a full understanding of exactly what changes are happening in the brain or what's causing them or what the root cause is with Alzheimer's. And so I think it's important to be optimistic, but I think we definitely need more data in this area before we can say that we're curing people of Alzheimer's.
And we need to be cautious, but the good news, the UCLA study shows 90% of the patients in the program showed reversal of cognitive decline within 6 months.
Now, is this the same? I think this is a study I read, and there were only 10 patients in the study.
That's correct.
So
that was the initial pilot.
Very small,
small group,
study, very small sample group. So it sounds really good to say 90%. I like that number, but that also has to be really, when you think about that, you have to really think about how many patients are in this study. Is it really reflective? Is it a large enough patient population? What are our controls within the study?
And even the researchers
said,
reflective? We need to have broader studies. My point is, don't hold up the therapy because they're not bigger studies, because the therapies all make sense, they're practical, and we should be doing them anyways.
So you're talking about things that are really, that we could do personally that would be preventative, to try to have a path for ourselves that wouldn't lead that way. And you think any individual should be following that path?
Yeah, and we were talking about sleep earlier. For instance, sleep apnea. I had a patient this morning who I called. He was in Texas, and he's had sleep apnea for at least 6 years. And he's 300 pounds. And he needs to aggressively manage sleep apnea, because if he doesn't, it's going to increase insulin resistance. We know that. There's no question that it dramatically increases insulin resistance and therefore makes you more pre-diabetic or diabetic. In fact, he has advanced pre-diabetes, so his goal is to reverse that, to feel better, and he needs to be aware that he has risk because those apneic episodes actually are traumatic to the brain.
Dr. Younberg, thank you. I'm going to